Welcome back. My name's Will. I'm the Catholic dietitian, and I'm here with Dr. Natalie Carr Bustillo, a pediatric dentist. Coming up is Halloween, which is the precursor holiday to All Saints' Day. Halloween is a typical traditional Catholic holiday celebrated throughout the ages, and the United States has adopted it into its own. And now every kid goes around and trick-or-treats on Halloween to collect candy. Now there are a lot of good things about this tradition. Candy has lots of sugar, and someone who knows a lot about sugar is Dr. Bustillo. So thank you for coming on.
Thank you, Will. When it comes to cavities and sugar, really the frequency that you have sugar is more important than the amount of sugar. So grazing throughout the day is going to cause more cavities than having sugar once or maybe even twice a day. So if you're going to have Halloween candy, I like to have children get all their candy and have it in one day and then maybe put some away. But when we talk about sugar, what happens is when you put any kind of a sugar in your mouth, there's acid that occurs on your teeth, and the acid stays there about 20 minutes. And so it's important to make sure that you give time for the minerals in your saliva to neutralize those acids and therefore start to remineralize anything that has broken down. What we love to see is maybe have the children enjoy Halloween and enjoy eating the candy in that evening, and then maybe switch out that candy. And what I like to do is separate the good stuff from the stuff that we don't care for. And so then hide it, and then throughout the year, give it to them little by little rather than having a few weeks of just a ton of sugar.
Replacing some sugar with healthier foods like broccolis and cauliflower that doesn't have any sugar in it can be a really great option. Are there any types of candies that would be better for your teeth than others?
So actually, yes. Things that are sticky, things that stick and stay will tend to cause more cavities than things that wash off easily. So if you think of something like a Hershey's Kiss really melts easily in your mouth. And so therefore doesn't spend as much time in your mouth as maybe a gummy bear or some sort of a sticky gummy snack.
Like a Jolly Rancher?
A Jolly Rancher is going to really stick. Jolly Ranchers will kind of lock into your teeth also, so you have to be aware of Jolly Ranchers, especially if you have dental work where you may have fillings or crowns or even sealants, which are a protective coating that are put on teeth to protect them from cavities. So those can be popped off by things like Jolly Ranchers or sticky food. So being mindful of those will also help maintain your dental work.
In nutrition, there's a lot of buzz about the different types of sugars. So there's your sucrose, which is the combination of your glucose and fructose. And then there's, straight glucose, which you get dextrose or straight corn syrup. And then there's also fructose, which usually come in fruits. But many people say that fructose is more of the harmful sugar because the high fructose in a lot of things cause fatty liver disease, and having a more glucose base is healthier than fructose. So is that kind of the opposite?
With glucose, it's just going to be a little more acid producing. So what happens is sugars, when you introduce a sugar in your mouth, the sugars are being broken down by the bacteria in your mouth. And we have in dentistry what we call a Stephan curve. The Stephan curve shows us on a graph the drop of bacteria. Anytime your mouth, which usually lives at about 7.4, then anytime it drops below 5.5 pH, then there you're going to start to break down the enamel of the teeth. So if you think of trying to keep the pH or the acidity level higher so that you have less acid in your mouth, will reduce the breakdown of the teeth. It doesn't happen overnight. You break down a little bit and then your body will repair it. It's, are you breaking down faster than your body can repair? You are absolutely in a balance throughout the day of the breakdown and the rebuilding. So we want to keep you in a situation where you're able to rebuild as fast as you're breaking down. So if you tend to be one who is more prone to cavities, then it's going to be more important to watch the frequency, as well as making sure, of course, to brush and floss your teeth on a regular basis. We recommend twice a day for brushing and at least once a day for flossing.
Are there any foods that have sugar that may slow down the bacteria producing lactic acid?
So interestingly, actually, xylitol is antibacterial. So if you have things that are sweetened with xylitol, for example, there are xylitol gums that are available, Mentos gums, icebreakers, ice cubes have xylitol as the number one ingredient, but it needs to be the number one ingredient in the gum. And that xylitol gum will help to reduce the bacteria level.
Mm-hmm. And one other thing to note with xylitol is it's not a non-nutritive sweetener. It has calories in it. So if you have a lot of sugar or you have a lot of candy with xylitol, it's not like you're not getting any calories. Just because it's not pure sugar, you're still getting calories with your xylitol. And same thing with erythritol and all of your sugar alcohols. You're still getting calories.
Okay.
Although it's not nearly as many as, as
With
many
actual
as
sugar.
Exactly, right. If I brush my teeth or rinse my mouth with mouthwash before I eat sugar, does that help prevent cavity formation?
So not before. Actually, if you're going to rinse your mouth, you'd want to do it afterwards. So when we talk about chewing gum, the way it works is that chewing motion increases your salivation. By increasing your salivation, you're increasing the amount of buffers or the amount of mineral that is in your saliva that then can neutralize those acids, as well as it's mechanically removing the food debris. If you've ever had a potato chip and then you've chewed a piece of gum, that gum gets really gross. And it's because it's picking up all that potato chip that's stuck into your teeth. So the chewing gum after a meal will help to remove that food debris and therefore could help to reduce your cavities in that way. So when we talk about cavities, we talk about some people are absolutely prone. Some people have a lot of the bacteria that produces cavities because they just have a more acid producing bacteria in their mouth. Whereas other people don't have as much acid producing bacteria, therefore don't tend to get cavities. Most of us, if we brush well and we floss well and we use fluoride toothpaste, then we can keep those cavities at bay. Some people just need to use products. Some people need to do a fluoride rinse every day, would need to make sure that they're brushing maybe not twice a day, but maybe 3 times a day to keep the acid at bay. You can also make a solution of a liter of water with a spoonful of baking soda and rinse with that. And that will also take away the acidity. And if you rinse with that after meals, you immediately will remove the acid from your teeth. You don't want to brush with baking soda on a regular basis because baking soda is very abrasive and will take away your enamel.
You mentioned a lot about salivation and how saliva helps neutralize some of the acid that the bacteria cause. How do we increase our saliva production?
Well, so that's an interesting thing. So one thing that's important with saliva is drinking plenty of water. If you don't drink plenty of water and you are dehydrated, you're going to have less salivation. So maintaining an appropriate amount of water consumption is important. Now, what's tricky is that a lot of medications that people are on will reduce the amount of saliva that you have. So a lot of people will have what we call dry mouth, and those people are more prone to cavities. So certainly children who take medications will have more cavities predisposition, and older adults will also be more prone to cavities because of having a drier mouth. Your saliva is your friend. Not only does it help with the digestion process, but it also has those minerals that will buffer the acids in your mouth and will help to repair things.
If calcium and phosphates are minerals that really help buffer some of those acids with the saliva to help them get flushed down and neutralize the acids, there are some foods that we can eat that have lots of calcium in them, mainly fortified milks or calcium carbonate supplements in very small amounts. Vitamin D helps absorb some of that calcium as well. So if you're deficient in vitamin D or you need to get some sunshine, that's a good way to absorb some of the calcium to help neutralize and buffer.
I think the recap here is making sure that you watch the frequency that you eat the sugars, not just how much, but how often you eat, makes probably the most important difference with your teeth.
For Halloween, making sure that you're allowing your kids to have a feast on All Saints Day when they collect their candy. Candy is a special treat for feast days that really help you live out the liturgical life. Have a feast, but know that it's a feast and not an ongoing recurrent thing where maybe they save their candy for months and months at a time. They have their candy on All Saints Day, they have their candy on All Souls Day, they have their candy on Christmas time, but not having it as a continual source throughout the day without any sort of toothbrushing or tooth flossing.
Right, you only want to floss the teeth that you want to keep.
Exactly.
Absolutely.
There you go.
And what's interesting about that is only about 11% of the population flosses their teeth. Children who floss their teeth or have their teeth flossed by their parents till they're 10 to 12 years of age become adults who floss. So those habits that we create early on become the habits that we keep.
If someone has parents who ate really healthy foods, the kids are going to also go and eat really healthy foods, and they're not going to have nearly as many weight issues or health issues as someone whose parents ate really poorly. So just as diet is hereditary, toothbrushing and proper oral hygiene seems to be pretty hereditary as well.
Absolutely. It makes a difference. You learn to do what your parents teach you. So it's important as parents that we set a very good foundation for our children.
Awesome. Well, thank you for your time and thank you for coming on.
Thank you.
Be sure to like and subscribe for more content from The Catholic Dietitian.